Good morning. Good morning, colleagues, and thank you for joining us for the final day of this Africa Month Symposium, hosted by the African Peer Review Mechanism, the Nelson Mandela School of Public Governance, and the University of Cape Town Convocation. We've been focusing on Africa's innovation in the global fight against the COVID-19 pandemic. And perhaps I should pause a little bit and thank Professor Eddie Maloka for his collaboration, his leadership. This is not the first time we are hosting a joint event to celebrate Africa Month, and it is through his leadership that we're able to do so. And so this year we host it under different conditions or circumstances as a result of COVID-19. Our 5 online sessions this week provide an extremely worthwhile opportunity to share best practices, strategies, and responses to COVID-19 from across the continent. And we are proud to be celebrating Africa even more so in these turbulent times, which call us to rise to many challenges. Africa Day celebrates the successes of the Organization of African Unity, which was formed in Addis Ababa on 25 May 1963, and later became the African Union. And this celebration provides us with an opportunity to promote African unity and deeper regional integration, as well as to signal our commitment to a common destiny for our continent. Our co-hosting of the symposium has reflected a spirit of goodwill, as well as shared ideals and commitment to good governance, as well as working together to help solve Africa's problems. The role of the African Peer Review Mechanism, which is an autonomous entity of the African Union, is to promote policies, standards, and best practices that lead to good governance in member states. UCT Convocation provides a platform for alumni to actively participate and critically engage in pertinent issues affecting the university community at large. And the Nelson Mandela School of Public Governance, based here at UCT, promotes strategic public leadership by bringing together policymakers, experts, researchers, and leaders in society around key policy issues. And partnerships such as these are vital. Good governance and leadership are critical in the way we navigate through this unprecedented time and embrace the future of our continent. So today, we will hone in on Pan-African reflections on leadership and good governance during COVID-19. We look forward to views of our panelists, including Dr Mcebisi Jonas, the chairperson of the MTN Group, and South Africa's former Deputy Finance Minister, Ambassador Said Djinnit, Senior Advisor in Accord, Special Envoy of the UN Secretary General for Great Lakes Region, and Dr Bongani Dulani, Senior Lecturer for Political and Administrative Studies at the University of Malawi, and Dr Gwamaka Kifukweand, Independent Consultant in Leadership and Sustainable Development in Africa. We hope that the plan was that the session would be moderated by Dr Shanil Haricharan, Academic Director of the Nelson Mandela School of Public Governance. I'm hoping that all of them are present here today. This afternoon's panel on COVID-19 philanthropy on the continent will feature Karl Manlan, Chief Executive of EcoBank Foundation, Bongiwe Mlangeni, Chief Executive of the Social Justice Initiative, and Bulela Ngewana, Director of the Open Society Foundation in South Africa. This discussion will be moderated by Dr. Beginkosi Moyo, Chair of the Africa Center for Philanthropy and Social Investment at the Wits Business School. Professor Eddie Maloka, Chief Executive of the African Peer Review Mechanism, and of course, President of Convocation here at UCT, and Professor Faisal Ismail, Director Designate of UCT's Mandela School of Public Governance, will wrap up our 3-day symposium this afternoon. Across the 3 days of this symposium, we have drawn from a range of views, sectors, and backgrounds. And this is because our responses to COVID-19 require thoughtful input and cooperation across the broad spectrum of African experience. This continent represents so many different people, many living in poverty and violence. While many challenges have emerged from this pandemic, we were facing many challenges even before we heard of COVID-19. My hope is that our responses to this pandemic will serve as a catalyst to respond effectively to our historic challenges as a continent. For example, the African Union's 2020 theme for Africa Day this year is silencing the guns, creating conducive conditions for Africa's development to achieve the goal of a conflict-free Africa. Violence and conflict have plagued our continent for centuries. We have seen how easily violence arises even during lockdown in South Africa, when actions of members of the police force led to an investigation this month by the Independent Police Investigative Directorate. While COVID-19 has saturated our news and conversations and impacted our decisions over the past few months, we must not forget the many people in Africa who have lived in the shadow of conflict and war, as well as gender-based violence in their own homes. We must not allow COVID-19 to diminish our resolve to silence the guns across Africa. Violent conflict is one of the biggest barriers to development and education. When fighting breaks out, schools in conflict and violence-torn areas are often forced to close. This often starts as a temporary measure, but can become permanent. It has become a pattern in war zones in Africa. This has devastating impacts on children and young people, many of whom have to abandon their dreams of completing their education and setting themselves up for a better life. According to the African Union, just over half of the countries in Africa have endorsed the Safe Schools Declaration, an intergovernmental political commitment to protect students, teachers, schools, and universities from the worst effects of armed conflicts. All African countries have been urged to endorse and implement the declaration to promote a safe and conflict-sensitive education. The AU has raised the need to put in place alternative education programs, free education, safe and appropriate school infrastructure, and access to technologies in remote areas and emergency situations. These goals must not fall by the wayside simply because we have to deal with COVID-19. Education has a profound impact in promoting good governance, democracy, and peace. Countries across Africa have seen the overwhelming benefits of resolving conflict through education and engaging with people across communities and sectors. Education can build peace by contributing to political, economic, and social transformation in post-conflict society. It has the power to shift attitudes and behaviors against violence. Universities have a critical role to play in engaging students in debates about legacies and causes of conflict. We need to look at how reconciliation and forgiveness have been able to shape societies leading to healing. We need to honor our peacemakers and learn from them, and we have a lot of them on the continent. Universities and institutions can play a major role by raising awareness of the roots and causes of conflict and by providing people with the skills and knowledge of how to respond to conflict in a peaceful, constructive, and collaborative way. Education has helped democracy to push ahead in Africa. In recent years, most African states have started accepting multi-party systems of governance and the rule of law and human rights. With the help of active citizenship, countries are also becoming far better at fulfilling their democratic obligations. We can now sow the seeds of peace through education, engagement, and good governance that is transparent and is in the interest of the people of our countries. This also applies to how we apply scientific approaches to challenges such as COVID-19. The pandemic has extended its tentacles deep into our countries. President Cyril Ramaphosa, in his role as chair of the AU, said this week, and I quote, COVID-19 knows no borders, nationality, or skin color, close quote. In our different countries and across our borders, we need to rise above our differences and deepen our solidarity as we face this escalating humanitarian crisis which threatens to scuttle our development gains. This week, the World Health Organization reported that 52 countries in Africa had recorded more than 100,000 known COVID-19 cases. More than 3,000 people have died so far from the virus in Africa. While we haven't seen the scale of COVID-19 that has ravaged developed countries in Europe and in the United States, the future is uncertain. But this crisis has also created opportunities to work together like never before and to make this a defining moment for Africa. We must play a critical part in coming up with solutions to our continent and our world. This includes being involved in clinical trials in Africa and generating research that will provide solutions for the COVID-19 pandemic. As COVID-19 tightened its grip on countries in the north earlier this year, a flurry of COVID-19 clinical trials were registered. This is, of course, essential, but it also raised concerns. Nature reported on the 3rd of April that of the more than 300 clinical trials that have been conducted for COVID-19, most are in China and in South Korea, with Europe and the United States in close pursuit. Sadly, very few were taking place in Africa, Latin America, and Southeast Asia, which are critical areas where the virus could surge next. There have been some moves to shift this uneasy balance. A group of scientists, physicians, funders, and policymakers from over 70 institutions in over 30 countries have launched the COVID-19 Clinical Research Coalition, which aims to accelerate COVID-19 research in Africa, Latin America, Eastern European, and Asian countries. This has included researchers from UCT. Other lobby groups and initiatives have emerged as well to push for more COVID-19 research and trials in Africa and the developing world. We can ask why. Well, it is essential for Africa to take part in all levels of clinical trials for a possible COVID-19 vaccine or any medical treatment that could save lives. The world is a global village when it comes to pandemics such as COVID-19. There is no need for us as Africa to isolate ourselves and say we do not want to cooperate with Western scientists. We need to work together for the sake of all people, including all Africans. Because problems of Africa are problems of the world, and problems of the world are problems on Africa. COVID has emphasized that fact. There are sound medical reasons for testing a vaccine in different kinds of communities, including low-income countries. Prior experience has demonstrated that people in different countries may have different underlying conditions that cause them to respond differently to vaccine candidates. More specifically, it has been found that a virus may develop different strains in different populations. So a vaccine that is effective in Europe may be less effective in Africa or South America. Against this backdrop, the notable absence of developing nations from COVID-19 treatment trials around the world should be a true cause of concern for all of us. The World Health Organization has called for more African nations to participate in its solidarity trial, which will evaluate the effectiveness of 4 possible drugs or drug combinations to treat COVID-19 in thousands of patients around the world in comparison with the standard of care. Researchers are urging faster action on clinical research in countries with ill-prepared health systems to try to minimize the effects of the pandemic there. The World Health Organization has said that clinical trials in resource-poor settings are also essential for its coordinating role in the global response to COVID-19. It could help the World Health Organization to make evidence-based decisions on policy and practice in a bid to save lives. The COVID-19 crisis presents an opportunity for African scientists to provide critical insights into the characteristics of the virus and effective strategies for its treatment. Insights that could help humanity respond more quickly and effectively in future pandemics. In his remarks to commemorate Africa Day, the director of the World Health Organization commended the continent for having only 1.5% of the world's recorded cases of COVID-19 and less than 0.1% of deaths. He pointed out that Africa was the least affected region globally in terms of the number of COVID-19 cases and deaths reported to the World Health Organization. Of course, this situation can change. It is early days, and we have to remain more vigilant than ever. The World Health Organization has lauded many African countries for responding rapidly to curb the spread of COVID-19. South Africa, for instance, went into lockdown in the early days of the virus reaching us, which is why we are conducting this symposium online. The pandemic has forced us into an excruciating balancing act between stemming the spread of the virus, maintaining the economy, and staving off hunger. But such bold decisions have had to be taken. African countries have also been guided by a comprehensive strategy formulated by the African Union. African countries have been credited by the World Health Organization for our experience and expertise in tackling infectious diseases such as polio, measles, Ebola, yellow fever, and influenza. In Southern African countries, particularly South Africa, we have some of the world's foremost clinicians and researchers in preventing and controlling the spread of TB and HIV. Our countries could learn important lessons. Other countries could learn important lessons from our continent. We need to harness our resources and insist that we contribute to knowledge that will help save lives. Focusing on the science now will also help us in time to change the trajectory where Africa is simply seen as a recipient of research conducted in the West. Currently, less than 2% of clinical trials covering all diseases and conditions are conducted on the African continent. This has led to medicines not being optimized for African patient population. It affects the doses we take as well as the dosing regimes. This can lead to inferior treatment outcomes as well as concerns about toxicity. And this situation needs to change. COVID-19 offers a window of opportunity to raise the profile of African research and encourage investment in science on our continent. It would help us to reduce Africa's dependence on imports of medicinal and pharmaceutical products. We have the ability to seed a drug discovery and development industry that could create jobs and a value chain of investment. We need cooperation between Africa's emerging entrepreneurs, investors, and industries. As African nations, we also need to promote the fair governance of life-saving medical treatment. On 14th May, President Ramaphosa joined 139 other heads of states and former heads of state and other prominent public figures in a letter advocating for the people's vaccine. The letter stated that, and I quote, "Governments and international partners must unite around a global guarantee which ensures that when a safe and effective vaccine is developed, it is produced rapidly at scale and made available for all people in all countries free of charge," close quote. The World Health Organization has embraced a proposal to create a voluntary pool to collect patent rights, regulatory test data, and other information that could be shared for developing drugs, vaccines, and diagnostics to ensure, for instance, that COVID-19 medical products are accessible to poorer populations. I believe that our continent can not only survive, but thrive in a post-COVID world. Our young people are using social media to push for social change, and they need our support and guidance. The virus is bringing into sharp relief the fact that the old ways of life and the economic choices that have fostered poverty and inequality are unsustainable. South Africa was experiencing this even before the pandemic. Our economy was downgraded to junk status just as we were going into lockdown. But now the entire world is facing an economic crisis. And we know that even more changes are coming. I have come to realize that for education to be relevant for the kind of world the students of today want to build, we have to allow them to help reshape our educational institutions and point out our blind spots, even when it's uncomfortable. Universities can no longer rely only on the traditional Western model of thinking. Instead, we need to develop curricula and an institutional culture that embraces the diversity of our young generation. The challenges sparked by COVID-19 have already spurred many Africans, young and old, into action across the continent. Individuals and teams at UCT provide some local examples. Lynn Reminzoal, a PhD candidate in computational neuroscience, has designed a dashboard to offer South Africans a comprehensive overview of the latest coronavirus statistics. It has now gained international traction. Since creating it in late March, Lynn has been inundated with requests for the design of similar dashboards around the world. And UCT alumnus Tammy Shiklas has built in Supply a centralized marketplace that connects those who have personal protective equipment to those who need it the most. He has already registered more than 500 suppliers, 50 million personal protective equipment items, and over 200 organizations wanting to purchase PPEs. Through his work with the Southern African HIV Clinician Society, Tamir has been alerted to the needs of doctors in rural areas who also lack the required PPEs and fall out of the ambit of public hospitals that are sufficiently covered by the government. UCT's Knowledge Translation Unit, in partnership with the Western Cape Department of Health, has developed, printed and distributed a series of 3 million leaflets and posters in 4 languages to bring essential practical information to community members on everything from how to wear a mask properly, to how to clean surfaces, what to do to protect people with chronic conditions, and a step-by-step guide for health workers on how to manage and consult with someone with COVID-19. These resources are also used in Nigeria, Ethiopia, and Brazil. Universities across South Africa are working on projects that focus on the COVID-19 pandemic. UCT's Faculty of Health Sciences has established a COVID-19 research task team comprised of senior academics in the fields of infectious diseases, medical virology, human biology, and public health, and family medicine to help manage the pandemic in the country and develop ways to deal with other future outbreaks. Among other aspects, researchers are investigating diagnostics and potential tests of immunity, as well as developing vaccine candidates, laboratory reagents, and therapeutic treatment trials for COVID-19 patients. I have been quoting the late Winston Churchill several times since the pandemic started, and he said, "Never let a good crisis go to waste." And I think this is an important quote to hang on to in this time of crisis. Across the continent, we are witnessing examples of great courage, great compassion, and ingenuity in response to the COVID-19 crisis. We must grab the opportunity it presents to harness these experiences and apply their lessons to the many challenges this continent will face long after the COVID-19 has passed. This is a perfect time to re-examine our governance practices and forge new ways to lead Africa into a better future. And that's why these engagements in Celebration Africa Day are important. Thank you very much.
Thanks to VC Professor Phakeng for her inspirational input on the challenges, the opportunities, and good practices in Africa relating to a whole range of areas, including governance and leadership. I think it's a good segue into the next the fourth in our series of 5 webinars to commemorate Africa Day. Today's webinar will explore the theme Pan-African Reflections on Leadership and Governance during COVID-19, looking at good practices, challenges, and opportunities. On the occasion of celebrating Africa Day, I'm reminded of the late Professor Emeritus Philip Tobias, the South African paleoanthropologist and professor formerly at the University of Witwatersrand in Johannesburg, and a vociferous anti-apartheid activist. He said, "What has Africa given the world?" People often ask in a sneering and derogatory way, as if they already know the answer: nothing. But Africa has given the world humanity, and that is no small thing. And secondly, it has given the world the first human culture, and that is also no small thing. I would offer to add that in modern times, Africa has also given the world great leaders, men and women of exemplary standing in Africa and the world. Visionary leaders who boldly led resistance struggles against colonialist powers and their proxies over centuries across Africa in pursuit of our freedom and sovereignty. This is no small thing either. We are a continent with no fewer than 10 Nobel Peace Laureates. This is also no small thing. Africa has produced global leaders, including among our diaspora in many spheres of life. Prior to the start of COVID-19, as VC Phakeng mentioned, Africa and the world were experiencing major challenges as humanity and our planet were in a negative downward spiral. From climate change to wars to post-conflicts, inequality, poverty, migration, amongst many other challenges. During this unprecedented time, COVID-19 is further exposing the entrenched socio-economic fault lines in Africa and between the continent and global capital markets. Many lives and livelihoods, already precarious, have been devastated by COVID-19. As my colleague, Professor Carlos Lopez, sagely points out, the most devastating impact of COVID-19 in Africa is going to be socio-economic, and as highlighted by Professor Phakeng. While a few countries in Africa have learned from Ebola and other diseases and have fairly resilient health systems, many continental public health systems are compromised. One such limitation is the statistical capacity of African institutions. This capacity is critical to generate data on the pandemic for decision-making. Many nations are facing a crisis in public leadership, widely viewed as the weakest link in public governance. Over the past few decades, trust and confidence in the public service has declined remarkably across continents. Upholding democratic principles and public service values, the cornerstones of any public institutions, continues to defy many governments. Especially in a time of crisis like currently, and the uncertainty during a crisis which instills fear in people, citizens expect their leaders to be empathetic, inspirational, visionary, ethical, and authentic. How well have our leaders and public institutions responded to COVID-19 in upholding democratic governance principles and public service values enshrined in our nation's constitutions? During the past few months, we have observed good practices, challenges, and opportunities in African nations' responses to COVID-19. The example of exemplary leaders who have been praised for their transparent, compassionate, and inclusive leadership styles, while in some cases in the same cabinet, we have experienced authoritarian and punitive styles of leadership. Governments have been criticized for limited or lack of transparency, for poor coordination, unaccountability, muddled and at times irrational decision-making, promoting personal agendas or even whims, exclusionary, and using unnecessary force and abuse of power. On the positive side, COVID-19 has mobilized communities to show solidarity with the vulnerable communities, like the Community Action Network in South Africa. Civil society organizations have used the pandemic as an opportunity to support engaged and active citizenry in numerous solidarity initiatives. COVID-19 will generate many lessons for Africa, which provides opportunities for shifting public leadership and governance narratives, and to correct the disparities of the past through challenging the iniquitous global economic architecture through structural transformation, and in pursuit of the strategic development goals and sustainable development goals. And this will not be a small thing either. We are fortunate today to have thought leaders from Africa on our panel of speakers to explore the multifaceted issues relating to leadership and governance in Africa. This morning, Ambassador Said Djinnit from Algeria informed me that he will not join us on this panel as he had a family emergency. We convey our well wishes to Ambassador Said and to his family. To the participants of this Africa Day webinar, and to the panel members, we extend a warm greeting to you. And I'm in Cape Town, which is cold and wet and the unenviable epicenter of the COVID pandemic in Africa. We have 4 speakers today. We have Mr. Nomzamo Zondo from South Africa, Dr. Boniface Dulani from Malawi, Mr. Mcebisi Jonas from South Africa, and Dr. Gwamaka Kifukweand from Tanzania. I will start off with asking the panelists to put their mics off. Thanks. The participants can participate by using the Q&A to provide questions, comments, which we will put to the speakers at the end of all 4 sessions. I will first introduce each speaker before they speak, rather than introducing all of them at the start. Each speaker will share reflections on the challenges, good practices, and opportunities for leadership and governance in Africa during and post-COVID. I would also like to request each panelist to share a personal reflection on how the pandemic has affected them in the past few months. Each panelist will have 12 minutes for an input, and we will then, after the 4 inputs, have the question and answers, which will be curated by my colleague, Dr. Clever Chikwanda, which will be directed to the panel members. I would like to introduce Ms. Nomzamo Zondo, who is the Executive Director of the Socio-Economic Rights Institute of South Africa, SERI. Prior to taking up the position of Executive Director, Nomzamo served as SERI's Director of Litigation. She joined the organization as an attorney in 2013 because she was attracted to the opportunity of working with exploited communities while using the law to balance the scales of social justice. Nomzamo works mainly on cases related to the right to housing, defending communities threatened with eviction, and litigating for the provision of basic services in and the upgrading of informal settlements. In this role, Nomzamo played a key role representing the families and miners involved in the Marikana massacre and defending the social movements and community-based organizations fighting to secure adequate housing and informal traders and informal workers fighting for the right to earn a living. As Director of Litigation at SERI, she has led SERI's litigation unit to numerous groundbreaking victories. Nomzamo holds an LLB degree from the University of the Witwatersrand and served her articles of clerkship with the Wits Law Center. We are honored to have Nomzamo on our panel, and I would like Nomzamo to share with us her reflections.
Shanil, I just wanted to firstly thank you for the introduction and for your opening words. They were very insightful and they provoked some further thoughts from me. So I work at SERI, which has been involved in work around socioeconomic rights for 10 years. Most of that work has been around the provision of basic services in communities that are living in the inner city of Johannesburg and many informal settlements across the country. The work has also included work to facilitate the participation of informal workers in the economy, the protection of precarious workers, and mainly to ensure the involvement of ordinary South Africans in our political space, especially in as far as they're claiming their socioeconomic rights. And something happened with the announcement of the state of disaster, something that hadn't happened in the 10 years of our work. We have been working with government, at times collaborating, but at times litigating against them to enforce socioeconomic rights. And throughout this time, it's been a battle to convince government about how important these rights are beyond just simply being the provision of those basic necessities. And this crisis brought to the forefront why they are so important. And we had political will from government to address some of these very, very crucial issues. One of the biggest things that happened was the provision of 41,000 water tanks to communities who have been struggling for water for many years and have been reaching out through different methods to government and civil society, sometimes without any success. There was a moratorium placed on evictions, and there was also a commitment by municipalities to ensure the provision of water and sanitation, some of them finding money that they couldn't find for years to make sure the water tanks were filled. The city of Johannesburg, as an example, made a commitment not to disconnect any further services, and in practice, were actively reconnecting households, buildings, and communities who didn't have access to water. And all of this, I remember, just brought this relief of, yes, this is my home, yes, this is my country. And it brought a new hope about a government that is governing in the interest of its people. It brought back the social contract. And at that time, we also saw moves to listen to complaints. So once the government was acting, people were making suggestions, there was some criticism, but government acted, sometimes slowly, but they acted to respond to the suggestions that were coming around the inclusion of informal traders in the provision of food as an essential service, in the position of waste reclaimers, in the provision of a waste management service in the country, and all of this brought a lot of hope about not just the South Africa that we have now during a crisis, but of the potential that we have post-crisis. I think one of the very crucial moments was the formation of the COVID-19 People's Coalition, which started with a program of action, which identified as critical the firstly self-organization of communities and local action. The program of action immediately invited government to work alongside civil society, understanding that a crisis of this magnitude cannot only be addressed by government with the resources that it has, but it must be able to pull on the resources that we have as all South Africans to ensure that there is compliance, firstly with the national lockdown, but also that everybody in our society is able to have access to all their basic needs. And one of the disappointments and one of the missed opportunities of this crisis was the government's failure to respond openly to that invitation. While we saw in some departments like the Department of Human Settlements an approach firstly to include social movements working around informal settlements to bring in practitioners, but in general government wanted to think alone around the problems that we were all facing. I think what the crisis did, as Professor Phakeng pointed out, it made clear that we are all in this together. But the door wasn't open to civil society. Some of the very concrete suggestions made by civil society were ignored about ensuring that there is a civil society participation in the National Command Council. And even as we speak now, we've seen a very slow move to include civil society in the work that the government is doing. And I think this has taken us back, but also it's meant that we have not responded as efficiently as we could have during this crisis. And so one of the things that you've seen though from civil society is that even in the face of that, you have seen movements, community-based organizations taking action to support what is a crisis for all of us. Not just the elite, not just government. It's a crisis that's been worstly felt by those who are poorest in our society. So we have seen through the work of the C19 People's Coalition, the facilitation of food distribution, the facilitation of popular education to ensure that our citizens are complying with the national lockdown, to ensure that citizens are obeying the instruction to keep all of us safe. And it has been those initiatives that government could have leveraged, even in instances like the reopening of schools, that we already have thousands of activists who are available to the state, who are aware of the different circumstances of each community, who can be a readily available resource to ensure that firstly, if we do reopen schools, we have the resources to ensure that we minimize transmission. One of the things that has been very important for SERI, and I think for many South Africans, is the provision of basic services, and the fact that our failure to ensure that provision in informal settlements has put us in a very peculiar vulnerability to the transmission of the disease. We have, in some instances, informal settlements of 7,000 households that share two communal taps. And it's been important for the government to be able to access data that civil society, through non-government organizations, through practitioners, and sometimes through social movements have collected about the level of service that they have in each community. So we have had data that is sitting in different pockets. It is for government to come in and draw on those resources to make sure that we have the data to address the problems that we're dealing with. Secondly, we have seen how that has helped in the informal settlement space through the Asibigilane initiative, where we see over 165 informal settlements collating data about the provision of their services, monitoring what's been the response of their municipality to show which municipalities are actually responding effectively, and also showing where the biggest threats are coming from. And I think this opportunity still exists. It might have been missed in the first months of the lockdown. But if we are able to collaborate as government, as business, as civil society, to ensure that we bring our resources to make sure that at the end of this crisis, the country is better off, I think we would all benefit. And it's at most, we have had a government that's been willing to respond to suggestions, that's been willing to engage, but we remain, and I think civil society remains, as spectators in a crisis that actually needs all hands on deck. And I think it remains the call of civil society that government must come to the table, and we're willing to work together to address these very, very difficult circumstances. One of the main issues that SERI has been engaging around the issue has been the policing of the lockdown. Coming from an environment where we've had very poor accountability in cases of police brutality, the lockdown brought into that mix the South African National Defence Force, and again for the first few weeks, the country was aghast with stories of brutality and violence from the security forces. And already within the first 2 weeks of the lockdown, we had 2 deaths, which came as a result of the enforcement of the lockdown. We've had problems in relation to the use of arrest as a means of getting people not to breach the lockdown. But the main challenge, I think, has been this issue of police and army brutality, and this all came to a head when Mr. Collins Khoza's family took the Ministry of Police, the Minister of Defense, and the Presidency to court to say we need to find a way to enforce the lockdown, which takes into account the human rights of the citizens, and a way that treats citizens understanding their rights and also protecting them. And the main challenge has been the response of the leadership, starting from the ministry to the senior management team within the SANDF and the Ministry of Police. And unfortunately, the president, who has been lauded across the globe for having openly communicated with South Africans, for having clarified issues about our COVID response, has really failed to intervene on this space around how we can enforce a lockdown that is respectful of all of our citizens. And I think this all came to a head at the beginning of this week when the South African National Defence Force filed an affidavit in the courts explaining what they've done to comply to a judgment that was given by Fabricius around the issue of the Khoza family and around the enforcement of the lockdown. And the main concern with that was that it was clear that the Ministry of Defense was complying for the sake of compliance. Even worse, what we saw happening was that the Ministry of Defense has and continues to take a position that the army members who killed Mr. Khoza were acting in self-defense. In fact, most offensive is this code of conduct that has been issued for the army in the duration of this operation, which says at every step that in each scenario, the army have an inherent right of self-defense. And I think what makes it even worse is that the army specifically pulls out the incident of Mr. Khoza, which says if you see a glass of alcohol inside a yard, you have a right of self-defense. And what that says to us is that the army has chosen to close ranks instead of care for the collective well-being of all South Africans. And my call would be that if we have true leadership in this country, then the presidency and the Ministry of Defense would adjust their response and ensure that they are communicating to the army that any acts of police brutality will not be acceptable and that there will be harsh circumstances against those who take such steps. I'm quite hopeful that if in the time that we have, as you see, this is a long-term game, that government brings in civil society, even in the conversations around police brutality, in the circumstances around livelihoods, as we've seen with the inclusion of precarious and casualized workers in the UIF TRS scheme. We have a chance to end this crisis in a much better position. Thank you so much. Over to you, Shanil.
Thanks, Nomzamo. Thank you for the very insightful reflections and keeping in touch with what's happening on the ground and how security forces are responding to the current lockdown and implementing the regulations. The next speaker is Dr. Boniface Dulani from Malawi. Dr. Dulani is based in Zomba in Malawi, and he's a senior lecturer at Chancellor College, University of Malawi, in the Department of Political and Administrative Studies. He lectures in political science at the University of Malawi, Chancellor College. He also doubles as the Director of Survey at Afrobarometer. We at UCT work very closely with the Afrobarometer. Boniface holds a PhD in political science from Michigan State University, where he graduated in 2011. He also studied at the universities of York and Sussex in the UK, and from where he respectively graduated with a BA Political Science and a MPhil in Development Studies. He is a recipient of several awards, including the prestigious Fulbright Fellowship for his doctoral studies at Michigan State. He continues to research and write on the topic of term limits and the broader areas of democracy and governance. He is a member of many African and international political science associations. We're glad to welcome Dr. Boniface Dulani to take the floor next and to share with us his insights and reflections.
Thank you, Shanil, and thank you for inviting me to be part of this panel. My presentation today is going to build on the previous speaker's presentation, but to highlight, I think, the importance of leadership that listens to voices, multiple voices, really in the face of COVID-19. Listening to Nomzamo and also looking at the media in terms of the general, I think, adherence to the lockdown in South Africa, given, I think, how the leadership there, the top leadership, consulted various voices from opposition voices, business sector, and civil society, among many voices. That really stands in contrast with the situation and how we have faced COVID-19 in my own country here in Malawi, where a government that, and the leadership rather, that has barely engaged other stakeholders in formulating, decisions in terms of fighting COVID-19, have been met with open resistance, and that sometimes open defiance, to the point that when a government here wanted to introduce a lockdown, it just elicited spontaneous protests on the streets. And eventually government ended up abandoning the plans to introduce a lockdown. So why is this important? I think that these two contrasting cases, as I already highlighted, underscore the importance of a leadership that engages and listens to multiple voices. More importantly, in this discussion, I would like to highlight the importance of leaders to listen to the voices of ordinary citizens. Of course, across the continent, we see, and the evidence shows us, that even before COVID-19, healthcare and provision of healthcare has been and remains a big challenge that confronts most African leaders. When we look at recent Afrobarometer surveys, for example, we find that healthcare is cited as the second most important problem that citizens across the continent, from North Africa through West Africa, East Africa, Southern Africa, Central Africa, highlight that this is the most important problem that they want their political leaders, their governments to address. I think health is only second really to unemployment as the most important problem that political leaders, citizens on the continent want their political leaders to address. And of course, COVID-19 has underscored again why addressing health is an important challenge and requirement for our political leaders. We know that over time, our political leaders have tended to neglect the local, investing in local health systems, and they themselves prefer to fly out to Europe to other Western nations and other countries outside the continent when they themselves fall ill, exposing a lot of citizens on the continent that can barely manage to go out of their own community, exposing them to substandard health care to the point that some citizens prefer just to consult, traditional healers, oracles and the others, because the health system that exists is considered to be of very poor quality. Indeed, this is backed up by evidence. Again, looking at the survey data, we see that across the continent, 53%, more than half of citizens say that they have experienced shortages when they've ever sought to access health care. So health care is not only a critical problem, but oftentimes when citizens require it, they are unable to access it. Indeed, we see, of course, as one would expect, huge variations across the continent, starting from maybe a low of 4% of citizens in Mauritius who tell us that they ever went without health care when they needed it. But when you look at that on the other extreme end, we have countries like Guinea, where 69%, or say almost 7 in 10 of citizens say they were unable to access health care when they needed it. And this was before COVID-19. And one would imagine that now that COVID-19 really has exposed the inefficiencies and weaknesses in our health systems, the demands on the health systems are going to increase, especially as the number of cases do increase over time. But then whether the systems will be able to cope remains quite a big challenge, and something that our political leaders really need to be considering to address. And even when citizens try and access healthcare, and apart from the challenges of not being able to access medical care, the medicines and availability of medicines and health personnel, a lot of people also end up having to pay bribes. And I mention this because we have read again that there are dangers that COVID-19 is being used by some of our political leaders to indulge in corruption, to line their own pocket by using the COVID-19 funds instead of investing in areas where those funds are much needed. Those funds are instead being used to line up pockets of politicians. And this again applies to a lot of countries on the continent, including my own country of Malawi. So when you find that 13% of citizens say that whenever they sought medical care, they ended up having to pay a bribe, this highlights a major challenge that our political leaders needed to address, that especially in times of pandemic and COVID-19 pandemic such as this, because paying corruption and bribes to access medical care imposes a huge cost, especially on vulnerable and poor citizens. The women, for example, the elderly, people without education, people that are unemployed, tend to be the ones that don't have the necessary resources to pay bribes in order to access health care. So this really does make them even more vulnerable than they already were, and our governments really need, and our leaders need to be paying particular attention to addressing these issues. Now, one would hope that addressing corruption in times of COVID-19, addressing corruption in our health systems should not only be limited to these times of COVID-19, but rather should become the norm, that whenever people need and seek health care, they should not have to pay these bribes. So we can use this as the first main speaker pointed out, that never let any could crisis go to waste? One would hope that we can use this, pandemic as well to clean up our health system, to get rid of these corrupt tendencies, to make sure that the medicines that people need are available and accessible to all. Of course, because of these challenges in our health systems, it is not surprising that our citizens on the continent tend to rank government performance in provision or improving basic health services rather poorly. And of course, COVID-19 again underscores the importance of our leaders to invest in our health systems. I recall, in our own case, some years back, our former, one of our former presidents fell ill suddenly, and eventually, because of the emergency nature of his illness, he had to be taken to a local hospital, and he ended up dying on the way to the hospital. And even when he got to the hospital, it turned out that the main hospital did not even have the basic, basic equipment or basic medicines to address, I think, his particular medical emergency at that particular time. So one would hope that when you look at COVID-19, the borders are closed, there are no flights. So our political leaders have to realize that they will never always have a chance to be flown outside their own, outside our countries. They will never have, the opportunity when you're faced with a pandemic like this to go to hospitals that, in the West that are already themselves overwhelmed with attending to their own local peoples. It is important that our leaders should invest in our own health systems. Of course, the pandemic also, in my view, has underscored the weakness, the challenges of fighting a pandemic when we have bad and democratic leadership. Again, when you look at, I look at my own country of Malawi, we have a situation at the moment where we have a government and a president that the courts have. My apologies, my connection went out for a moment there. Fighting a pandemic when you have a government that has questionable legitimacy poses enormous challenges in its ability to enforce measures to address a pandemic like this. So government's decisions in our case, in ordering, social distancing measures, ordering, reduction in public, a ban on public gatherings of more than 100 people have simply been ignored, because most people look at the government making these decisions as itself lacking, sufficient legitimacy to tell them what to do. So we see a situation now where we have opposition political parties going out on a full-blown campaigns attended by thousands and thousands of people, as exposing many people to the pandemic, to the people that are attending these campaign rallies. So again, it's important that the governments also have have legitimacy, whether through elections or through consultations, by bringing on board different stakeholders in order to be able to fight pandemics such as this. So as maybe my concluding thoughts, it's important, as already pointed out at the beginning, that our political leaders especially should ensure that they seek the voices and the input of multiple stakeholders in coming up and designing solutions to fight the pandemic. Otherwise, they will face resistance. It is also important that we address these issues of access to health care. Again, our political leaders should learn to invest in our own health systems, so that the health systems are accessible to all citizens and rather than waiting, assuming that they themselves will be flown out, they should build health systems locally that they themselves will be proud to say, if I was ill, I would be able to go to these health systems and get assisted. And we've seen this in Europe. I mean, the example of the British Prime Minister, going into a public hospital, when he fell ill with COVID-19. So we need this holistic approach, but also address these questions and the challenges of corruption. Now, you asked Shanil that we end by also reflecting on how COVID-19 has affected some of us personally. Of course, in my case, I think we've faced these challenges of research where now we are unable to do any face-to-face interviews, and we are being challenged to explore other options of doing research. But by and large, I think that we have a lot to learn, and our leaders have much to learn from hearing it from the voices of ordinary citizens. Once again, I thank you for having me on this panel.
Thanks, Dr. Boniface Dulani, for sharing with us how COVID-19 is exposing health systems capacity, accessibility, and corruption. And now we will have Mr. Mcebisi Jonas. Unfortunately, we've been battling to get his camera to work, and we will only have his voice. Just an introduction of Mr. Jonas. He's played a key role as a political activist during apartheid in a variety of organizations. Of note, the United Democratic Front and the African National Congress, and has spent time in exile and returned to serve in organizations in South Africa before taking up political positions in the democratic government, having served as the finance MEC, or the provincial minister in the Eastern Cape province, and also as the CEO of the Eastern Cape Development Corporation. He is also the former Deputy Minister, the National Deputy Minister of Finance, and a Member of Parliament. More recently, he played a seminal role in civic activism against state capture. He, together with the former Minister of Finance, spoke out against corruption during the term of the former President Zuma. He is currently the board chair of South Africa's MTN Group and a non-executive director on a number of other company boards. He is also one of the 4 presidential investment envoys appointed by President Ramaphosa to attract $100 billion to South Africa. We are honored to have Mr. Jonas joining us today, and we are glad that the techies behind the scene were able to at least get his voice so that he can participate. So, Mr. Jonas, please, can you share your experiences? I know the 10-15 minutes is not going to be sufficient, but let's make a start, and then we will take further inputs during the panel discussion. Thanks.
Thank you very much. I hope my voice is clear. Thank you very much for the introduction. The VC, esteemed leaders from government, business, civil society, academics, and colleagues. Let me begin by thanking you for inviting me to be part of this highly important webinar. Given that I have only 12-15 minutes to present, I will give a quick overview and I will touch on what I have observed across the continent, and then I will end up with 5 points which I believe will shape the new world. COVID-19 is a once-in-a-century type shock. History has taught us, the Great Depression being the most recent example, that crises of this scale and magnitude will profoundly reshape the next 50 to 100 years. Production and consumption patterns will fundamentally change. Technological transitions will be accelerated. Geopolitical dynamics will be accentuated. Technological transitions will be accelerated. And there will be fundamental rethink of the state and the market and the relationship between the two. What is certain is that the coronavirus pandemic poses the same challenges for the leaders of the African continent as it does for leaders elsewhere in the world. This is precisely for 2 reasons. Firstly, the large number of unknowns and uncertainties surrounding the virus continue to confound good policy making. We say listen to experts and scientists, but we are learning new things every day about the coronavirus and the medical science to combat it. Secondly, there is the life and death struggle to balance the economic effects of lockdowns with safe ways of dealing with the health crisis. In the midst of these unknowns, it is leadership and good governance which will be critical in dealing with the virus. So far, different responses have produced different outcomes. It is no accident, for example, that the US, Brazil, and the UK and Russia have suffered the most, or amongst the most pandemic deaths. Donald Trump, Bolsonaro, Boris Johnson, Putin are generally regarded as divisive and deeply flawed leaders. Compare this to the achievements in containing the virus of South Korea, New Zealand, Denmark, Germany, Taiwan, Singapore, and Vietnam. Apart from the fact that most of the successful nations are ruled by women, and I will refrain from drawing any conclusions from that. Their leaders were thoughtful and methodical, willing to listen to experts and to proceed with the trust of their people. These countries have 3 things in common. The first is wise policy making based on consultation and advice of experts. 2, sound governance, which means the ability to implement those policies effectively to protect public health, save lives, and ensure that aid reaches where it is intended. And thirdly, a 2-way street between the people and government, which flows from clear communication so that people understand what is being done and why. Social distancing cannot be enforced. It must be embraced by the populace at large. When it comes to leadership on the continent as vast as Africa, with 54 countries, there is not just one reality. But it would be fair to say that Africa on the whole has better fared than expected. In South Africa, President Cyril Ramaphosa's administration embraced policies based on listening to experts and was prepared to learn from what worked elsewhere in the world. The president acted early, and his message was well received across the nation, even as he was asking people to do unpopular and painful things. The country glimpsed a fleeting few weeks of unity. But the gap between intentions and implementation soon became apparent. The good start was somewhat squandered by mixed messages and exercise in old-style commandism and micromanaging that many found difficult to understand. Still, the sacrifice and hurting of the lockdown have not been for nothing. South Africa is one of the few countries in the world that had zero excess deaths during this period. But we should not flatter ourselves to believe that our president set an example to the rest of the continent. This kind of thoughtful governance was true of much of Africa. I would not want to call out everyone, but some of the leaders of governments that have stood out in the crisis include Uhuru Kenyatta of Kenya, Akufo-Addo of Ghana, Macky Sall of Senegal. Senegal, by the way, could soon be producing its own cheap coronavirus test that could produce results within an hour. There are others where the jury is still out. Egypt, which is one of the hardest hit countries in Africa, and Tanzania, which has been accused of covering up the true death toll. It might take years for us to reach full understanding about who got it right and who failed. From the beginning, assumptions were made that not only was Africa especially vulnerable to the disease because of its dense urban slums, large numbers of people with chronic illnesses, inadequate public health systems, but that its governments were too weak to deal with such a crisis. Of course, it is impossible to know how much government action in Africa was effective in slowing the virus and how much was due to other factors. But the reality is that Africa as a continent is still the least affected by the pandemic, constituting less than 1% of the global cases and deaths. This may be partially the warm weather and partially the fact that Africa is a young continent. The median age in Africa is 19, while most of those who are dying are over 60. Less than 4% of Africans are over 60. Those who argue that this shows why Africans should not do lockdowns, of course, underestimates the extent to which Africans revere their elders and find these actuarial exercises distasteful. Perhaps the lower rate is due to many African countries understanding the hazards of infectious diseases and how to deal with them. Even as the pandemic was making way around the world, more Africans were dying of Zika virus in northern Nigeria and Ebola in Eastern Democratic Republic of Congo than COVID-19. Nigeria, with a long experience of dealing with infectious disease and a heroic history of containing Ebola during the 2014 epidemic, was one of the several West African countries that launched mobile community door-to-door screening campaigns. Africa's familiarity with disease is similar to those Asian nations which were hit by outbreaks of severe acute respiratory syndrome, SARS, in 2002, swine flu in 2009, and the bird flu in 2013. However, even though Africa is the continent least impacted by the health crisis, it could end up the most damaged by economic calamity. South Africa, Nigeria, Ghana, Senegal, and Kenya have all implemented rescue packages of varying sizes to provide support to the poor and unemployed and to bolster their health system, just as tax revenues have literally collapsed. But costly as these are, they are tiny compared to the $1 trillion of stimulus that China, the US, or the European Union have been able to rustle up. African nations cannot simply spend their way back to recovery. The hard times have already tempted some countries towards authoritarianism, and the desperation and hunger of the many could precipitate social and political unrest. Without being alarmist, we are still at the beginning of this crisis. What is certain is that none of this is going to be easy. African economies have been flattened, and in order for these to come back to recovery, we cannot simply go back to old ways. I want to conclude by just raising 5 points which I think are crucial in defining the new world without getting into any discussion on those points. The first is the role of the state and market will be fundamentally rescripted. We need to rethink a new role for post-COVID state, one that is able to provide social protection for the poor and at the same time direct and influence the market towards higher and more equitable growth based on innovation and productivity. The so-called neoliberal model associated with small government, lower taxes, limited social wage spending, financial deregulation will almost certainly become a thing of the past. But as we look to reassert the role of the state, we must equally avoid typical failed state models of import substitution, nationalization, and price controls, and even strong capital controls that we remember so well on the continent. Chasing unsustainable grand plans that we have no capacity to implement or to afford will fail. The second point, general point, I think, is the weak leadership will cost lives. The pandemic has no doubt brought out the best and worst practice in political governance and leadership. Suffice to say, we must keep in mind that the very qualities required to defeat this virus, scientific know-how, capable and responsible governance and leadership, global solidarity, are what we will need for survival and prosperity in the years ahead. Thirdly, the COVID contagion will hit the African economy hardest. Underlying Africa's economic vulnerability in the face of COVID-19 contagion are a number of structural weaknesses. These over-dependence on boom and bust commodity export, weak intercontinental trade and logistics capability, and poor integration into higher production global value chain. However, all is not lost. COVID-19 has been an extraordinary setback, but the heartbeat of the African economy, the streets, the markets, the traders, the people, they remain very resilient and probably will be key to recovery. Africa was a net loser in financialized global growth model of the past few decades, but possibly it stands to benefit hugely from a new economy centered around green energy and lifestyles, digitization, and reconfigured global value chains. The fourth point is African countries do not have the balance sheets for a stimulus. Further compounding African countries' vulnerability is the current crisis is that high levels of foreign denominated debt and weak financial positions of many of the African countries. This implies that post-COVID recovery will reinforce inequality amongst and between nations, between those with balance sheet and those with weak balance sheets. We do not have the luxury of Japan, for example, which has the debt to GDP of more than 200%, but is able to implement a stimulus of $1 trillion. With a few exemptions, central banks in most African countries do not have the capacity to inject liquidity into financial systems. And if pursued in a non-deflationary context, could bring significant price stability. Simply printing money, as some experts are advocating, will risk the Venezuelan option, which will hurt Africa for decades to come. The last point is that we need a Marshall Plan for Africa. A major shakeup in multilateral governance is imminent and necessary. For Africa, the main lesson of this is, in the words of Ghana's finance minister, that is time to challenge the unbalanced nature of the global architecture. The coronavirus has taught us that the existential threats of the 21st century, from the pandemic itself to inequality, climate change, and many others, they threaten all humanity. And the reconstruction of global demand does not end at one country's borders. This This moment demands greater community between nations in fighting common enemy, including a global stimulus, a massive investment in infrastructure, fair terms of trade, and an easing of the unsustainable debt burden. This would also mean taking on the oligarchs and multinationals who have stashed so much of the world's wealth in tax havens. While we could argue that Africa is a special case and that the developed world owes us a special debt, we are not looking for handouts. We cannot look for handouts. A world hungry for demand will increasingly look to young Africa as a massive, dynamic, emerging consumer market. Investors will look to Africa as more profitable destination than some of the low-growth economies of the developed world. At the same time, from a Pan-Africanist perspective, Africa recovery and future will be closely tied to free trade area and integration that must now be accelerated for the continent. Thank you very much.
Thanks, Mcebisi Jonas. I think your Pan-African insights are very valuable, and I think your 5-point plan, in a way, has the key elements towards a Marshall Plan. I think the many points you've raised are coming across from the different webinars we've had so far, and I think I'm glad that we have the session to be able to pull together some of the key points that we should take forward post-COVID. Next, we have Dr. Gwamaka Kifukweand from Tanzania. Dr. Kifukweand is an independent consultant based in Paris, specializing in leadership and sustainable development in Africa. He served for over 5 years with the government of Tanzania at the Institute of African Leadership for Sustainable Development as the research and policy specialist. He left the Institute as the head of department for research and policy. He moved to France to improve his French and enhance his understanding of the Francophonie and of Francophone Africa by enrolling in a master's at Sciences Po. Since 2013, he has been the lead researcher and host of the In Focus and Meet the Leader TV interview programs publicly aired in East Africa. He's currently supporting the OECD's Development Cooperation Directorate's work on triangular cooperation. He holds a PhD in geography from the University of Nottingham and has been honored by numerous young and emerging leaders initiatives in Africa, including UCT's Mandela School's Building Bridges program in 2015. So I welcome our alumni, Dr. Kifukweand, to share his insights from the continent and from his experiences in France as part of the diaspora. And I would like to also congratulate him on behalf of the school for the arrival during the COVID pandemic of twins. Thanks, Gwamaka.
Hello, thank you very much for the introduction, and thank you for the team at UCT for considering me and inviting me to speak today. And I also want to thank my fellow panelists for some very interesting discussion points that I hope we can sink our teeth into later on. So to start off with, I should be open and say I am going to provide a view from afar, having been based here in Paris now for 2 years, although I maintain a strong connection to Tanzania. I'm not on the ground, and Tanzania has been a very interesting case for a number of reasons during this crisis, but also leading up to it. To start off with, what I've observed here, at least in Paris and living in the 18th district or arrondissement, for those of you who are familiar with it, has a significant North African, what they call Maghreb, and Sub-Saharan African community, particularly West African. Here, there have been quite a lot of problems associated with remittances, in part because quite a lot of people have lost permanent jobs, but also have had lowered, let's say, alternative income streams because of the lockdown and stopping activities, particularly restaurants, and therefore the transport sector at large. What this has also shown is the remarkable resilience of African families to find ways to communicate with each other, particularly as for most of us we're privileged here to be able to use the internet and so on. Not everyone back home or even here in France has that availability. So what we've seen for Africans based here in France, at least, and it's been a similar story in quite a lot of the diaspora in Europe, at least from what I'm hearing, has been this question of access to technology and the digital divide more broadly, particularly as schools have closed and skills for doing kind of remote working, as well as resources, have come into question. For those of us who have been able to view a lot of the kind of global news, China, of course, has stepped forward and has been very aggressive in asserting itself as a global leader, but also as a friend for Africa. Although many of us have also been privy to seeing some of the images of the mistreatment of Africans, particularly in Guangzhou. And so China, like the rest of the world, is also being brought into question for Africans and Africa more broadly. Speaking specifically about youth on the continent, I think it's important to distinguish between various different groups of youth in terms of trying to understand both the impact and then the prospects going forward. I tend to split youth into rural and urban categories because I believe these are two very different populations in Africa, and I'm going to speak very broadly. This is not necessarily true in all instances. When we tend to speak of youth and the opportunities associated with innovation, associated with new opportunities brought about by COVID and everything else going on in Africa, we tend to focus on a very particular educated, middle-class, tech-savvy, connected young Africa, which of course exists and should be celebrated and promoted and nurtured, but doesn't encapsulate all of us in Africa or all Africans broadly. The rural youth in particular have been hit by this crisis, particularly those who are poor. One example has been the closure of schools, which will have not just an educational impact, but also a nutritional one, where a lot of families have relied on schools for a decent meal per day for their children. Now, the longer term nutritional and educational and public health impacts will have to play out. But this has been significant politically as well. In my country, Tanzania, it's an election year, and the closing of schools, particularly for rural communities who are the majority bloc vote, this has been a very contentious issue, at least in the analysis, though not so much in the public communication. The second major distinction or kind of cutoff when dealing with youth is those who are economically active and therefore able to participate in a lot of activities, and those who are economically dependent. So either those who are vulnerable for whatever reason or those who are too young to work. And here again, there's a very big divide. Young people in Africa have been involved in mobilizing resources, involved in sensitization and awareness raising campaigns. A lot of them have been able to participate in innovation and funds and be active in trying to combat the virus. A lot of them are providers for their families and have been kind of go-between for public spaces or more mass gathering type spaces and their more vulnerable, say, elderly or even their own children. At the same time, those who are dependent, as I mentioned, have this challenge that has come up with the schools, and we really hope that the longer-term impacts can be at least curbed. Tanzania has a massive problem, for example, already with stunting, both within high-income and low-income families, broadly speaking. And so the crisis may reinforce that, but certainly hasn't introduced this as a problem. The third issue is this argument about comparative advantage of the African young population. I mean, the science will let us know as those investigations unfold. I have a slightly different concern, and some of the work that I've been engaged with here at the OECD has focused on the future of work. And what one major concern for young people here and in OECD member countries has been the phenomenon of the gig economy, the absence of safety nets, the longer term decline of collective bargaining and union powers. This has been ongoing since the 80s, it's a longer term trend. And then now the onslaught of automation and augmentation. And so the future of work more broadly poses challenges for African youth as they're preparing to enter a rapidly changing workforce that has, I think, been compressed. That kind of time frame for transition has been compressed by opportunities from very savvy companies who have downsized, who have accelerated their automation programs in order to stay productive and to stay profitable. And so this will be a challenge for young people as well as an opportunity for those who can kind of latch on and for those who can figure this out, but also for a lot of us who are going to have to ride out this transition. It will be a new arena that we don't know how will play out. From a broader leadership perspective, Africa has always been a fascinating case study for leadership. I personally have always felt that Africa has kind of stayed, I won't say stagnant, but has stayed in what Rousseau would refer to as the phase of the birth of societies. And there's a quote that I've always really liked from The Social Contract, which says, in the birth of societies, it is the chiefs who frame the institutions, and afterwards it is the institutions which mold the chiefs of the republics. And it seems that in Africa we're in a constant battle to define what we mean by the birth of our societies. I mean, the rhetoric around decolonization is still very active, for some valid and for, in my argument, some invalid reasons. And I believe that that holds us back. And so from a leadership perspective, we're still trying to define ourselves and our values in terms of what we mean by African societies and therefore African states. And in my view, and to be slightly academic, I think there are two broad tensions that are summarized quite well by Peter Eke in the seminal work from 1975. You have modern institutions that we're all familiar with, the separation of different parts of the state and powers, balancing of those powers, the different classes that are broadly speaking based on a European industrial and American industrial history. So on the one hand, you have Africa having to adjust to these structures and norms that we are used to seeing, particularly in the West, but in a lot of the world. On the other hand, you have African institutions that exist in and of themselves, and their kind of resistance to these modernizing or at least being overlooked. And a good example of this is the Gashasa courts in Rwanda. I mean, the most important thing for me in any governance structure, and therefore in any leadership discussion, is the question of justice. And so if your governance and if your leadership is not accessible at the point of concept, all the structures above it collapse and become meaningless. And this plays out in Africa quite a bit. We see that when certain models don't work from a broader global perspective, African leaders are very quick to either play on local customs, local traditions, and even during election season, these come to the fore, even though we have a very modern understanding of democracy and particularly of elections. A personal anecdote, for example, my father was involved in a local football team, and he's an engineer, and he's an engineer to the point that that's what he puts whenever he fills out these surveys that say, religion, he'll just say engineering. And he was involved in a local football team, and he's not a superstitious man, but every Saturday he would disappear for a few hours to go and see a local witch doctor. And one day I worked up the courage to ask him what's going on. I mean, he doesn't believe in this quote unquote nonsense. And his response to me was very telling, and I think this is true for the leadership challenge that is particular to Africa, where he said, you and I know it's nonsense, but if I go out there with this football team and we lose, and it turns out that I didn't go and see this witch doctor, who do you think they'll blame? And so the governance or the leadership challenge more broadly in Africa is not just about projecting particular modern values or a particular type of quote unquote good governance and carrying everyone along. It's also about relating messages to the expectations, the norms, the comfort zones of the electorate. And so during this COVID crisis, it's been a very interesting case study in communication and the messaging of how the society as a whole can, will, and should tackle the crisis and the kind of spillover effects that come from it. In terms of Tanzania specifically, the messaging has been mixed, to say the least. On the one hand, you've had a very strong narrative from the central government that business should continue, and the reasons are many. One, limited capacity for testing, the economic fallout, but also that there are other ongoing health concerns that have a higher fatality rate, and they're not preventing Africans or Tanzanians specifically from going to work, and why should this be any different? When we consider the realistic policy options that are available to Tanzania, lockdown just isn't implementable. And when we look to our neighbors in Kenya, although they've done a lot of good work, there's a lot of questionable practices in terms of the enforcement of the lockdowns. So at this point in time, particularly in an election year, the fractures between, say, policing or the police units and military forces in enforcing any lockdown laws or regulations would simply just be too costly politically, and to be honest, probably unfeasible and unsustainable beyond a few days or very specific circumstances. For us, the major fallout and the major problem has been in the tourism industry. 17% of our government's budget is basically about to disappear because of a lack of visitors, and then all of the kind of linked activities that go with that: restaurants, tour operators, and cargo handling, everything that is tied to that. And so Tanzania is very aggressively trying to re-encourage normality, almost by force of will. And very famously this Sunday we had an end of Corona party that was celebrated, and the message has been, we need to get back to work, move on. And since we had began this talk with a quote from Churchill, I'd like to end at least this part of my contribution with another quote from Churchill, which I think encapsulates at least Tanzania's approach, and I think quite a lot of the world's approach, for better or for worse, is the following: if you're going through hell, keep going. So with that, I'll end my contributions for now, and I look forward to discussing with all of you. Thank you very much.
Thanks, Gwamaka. Many interesting viewpoints from the youth to the diaspora to modernity or post-modernity and leadership responses, and especially the case of Tanzania. We now have a few questions from the audience, and I'm going to put out a few questions. I'm going to start off with 3 questions or 3 comments, and then we can decide which panel member would like to respond to it, or members. The first one is: how can civil society and organizations on the ground compensate for a flawed and limited government system? What best practices can be implemented to bypass a lack of government collaboration? That's the first one. The second one is: COVID-19 is reflective of an environmental crisis in that it is derived from a lack of respect for wild animals, with a crossing of the virus probably through the consumption of pangolins, a threatened species. Does this remembrance need to be woven into our thinking today? The third one is: do you think that the COVID-19 crisis will subvert gender equity initiatives? So let's start with those 3 questions and comments from our audience. And the floor is open. please indicate. Maybe we start with the first one on civil society. Can I direct the question to you, Nomzamo?
Sure. I think what has happened already, that civil society has on its own established its own collaborations. I think that's really the first point of call. If government is not willing to work with civil society, the best thing to do is to go back as civil society to see what are the resources that we have outside of government, and how do we use those resources to respond to the crisis. And secondly, I think there has been a lot of work being done around mapping what are community-driven initiatives, because I think that's where the most resources are sitting that are being ignored at this point. And I think if you merge those two systems, one, what is happening in communities currently, together what civil society is able to offer, we can then maybe leverage that with government. Some of these civil society organizations are supported by philanthropy, and using also the voice of philanthropy to bring government to the table. Those are the two things that I can think of right now.
Thanks. Any other speaker would like to add to?
Yeah, can I come in? Jonas is the name.
Thanks, Jonas. And then after that, Gwamaka.
Yeah. I mean, just to what Nomzamo was saying, I think the big lesson we have in the recent past in South Africa is that I think civil society probably increasingly needs to look at how it networks, because I think generally, I think one of the weaknesses that we've had historically has been a very disjointed action from civil society. And I think the fight against debt capture, etc., has always showed how effective we can be if there is a joined up action effectively. Now, and that's one part lesson. I think you need to kind of really look at networks, bigger networks, whether they are issue-based or general networks that look at empowering society broadly. The second part, I think, is that the very definition of civil society is about contesting power, not in the sense of election, but to ensure that you kind of take on board onto the table some of the issues that communities consider important, and also raise some of the issues that are central to our constitutions, etc., etc. So and therefore I think the danger in most cases in many of our countries that civil society organizations emerged out of the liberation struggle. And in many senses, because governments are former liberation movements, people tend to kind of avoid the confrontation and challenge. But I think if there's any lesson that we have is that without being able to, a civil society understanding that part of the job might be to confront and challenge powers that be, that as a constant, you're likely to achieve much. Thanks.
Thanks, Jonas. Gwamaka, I saw your hand up, yes.
Yeah.
Thanks.
So in terms of civil society compensating for flawed or limited government systems, I don't think that's a particularly helpful way of analyzing or even approaching any work going forward. Ultimately, the two will have to work together because government systems have an authority, have a legitimacy, and have a duty to address these problems. That's not to say the problems don't exist, but I think creating that tension, or at least exacerbating that tension between civil society and the state through service delivery, particularly with political figures, can sometimes undermine efforts on both sides. For a country like Tanzania, where civil society emerges much more because of an influx of NGOs in the 90s. I mean, we went from having less than, I think, 300 in 1991 to having over 90,000 by the end of the 90s in terms of registered NGOs. Means that the dynamic, at least from Tanzania, is very different. And we cannot assume on face value that NGOs or civil society organizations necessarily promote progressive agendas. So there has to be that back and forth, that constant dialogue, that constant power struggle between civil society and the state, or at least whoever is in charge. And so for me, and this is something I learned through UCT, this idea of working with the grain is key. Of course, that's a longer term strategy. That's not easy always to implement, particularly when there are short-term needs. But I think trying to find ways of bypassing governmental collaboration is wrong. Rather, if the government is not willing to collaborate, I would advise, go ahead, do what you can, keep the government informed, because from all experiences I'm aware of, government hates to be surprised, particularly from civil society, and then find a way to build the trust so that in future, these kinds of relationships and institutions can be relied upon. Specifically, just as a last point, for international NGOs and more kind of cross-country civil society organizations, they cannot operate in any jurisdiction by law without government approval. And so by definition, the idea of bypassing is just not viable and probably not advisable. We've seen already a lot of accusations that these are imperial forces, to use that language, or have external vested interests. And that may be true in some cases, but to avoid that, if it's going to be really a mission focus, the two need to learn to collaborate on each other's terms. And for civil society, that challenge is much more daunting because they don't have the same political legitimacy behind them, rightly or wrongly. Thank you.
Thanks, Gwamaka. Boniface, would you like to add to the question on civil society? Okay, let's move on to the next question on the environmental crisis. Yesterday we had a webinar looking at climate change and impact on the environment during COVID and post-COVID. Here we have a question around certain species and how do we in the midst of looking at the impact of the virus on humanity, how do we also be mindful about the impact on our environment pre-COVID, during the COVID and post-COVID? Gwamaka, you want to contribute to that?
Sure. I mean, there's valid evidence to suggest that there are going to be more pandemics going forward, and that there is a strong link with ongoing environmental crises. But I would caution against making too direct a link. I mean, epidemics are not historically new to us as a species or as a bunch of civilizations. I think what really this has pointed out is a structural problem. We have a history of epidemics across the world, and honestly, I think we as a collective, as a humanity, just got lazy. Epidemics are really about vigilance. We had Spanish flu, we've had Black Death, and so on. And particularly in Europe, this has come at a really interesting time as we've seen the rolling back of the welfare state. And I think there's been a clash of kind of two schools of thought. On the one hand, you have the argument that is more behavioral. We need to change the way we act, the way we consume, the way we go about our business. And that has environmental, economic, and all kinds of sustainability questions. On the other hand, you have a more technical approach that assumes, and I think has an overconfidence, in my personal opinion, that these can be technically solved. And so we've kind of dropped the ball on vigilance, on basic sanitary practices that that we've been preaching now during this pandemic, because we've had an overconfidence in technical solutions. And I think you do need a mix of both going forward. As a result, yes, there are strong links to the environment. Yes, we need to do much better at how we manage and interact and respect the environment. But that is not going to be the sole source of future pandemics. And really the key thing here is vigilance and investing in the infrastructure and having the safety nets around in case something does break out, that we can respond quickly.
Thanks. Any other inputs on the environmental issues?
I guess, I mean, the big, thank you very much.
Yeah,
Jonathan,
go ahead.
I guess the big issue really, I mean, if I'm following up on the last speaker, is that the many of the priorities like environment and even gender issues and all these other issues, given the constraints that we're likely to confront because of the demands of fortifying health systems and strengthening research on some of these issues and a whole range of the measures and interventions that we need to have, they just might undermine some of the programs on environmental management, even, I mean, some of the progress that we've made on gender issues. So I guess the big challenge for civil society and governments is actually being very vigilant that we don't slide back as we fortify our health system to fight COVID-19. We actually ignore all other priorities in the face of this. And I would argue that's probably the dilemma that all of us would have to deal with and manage.
Thanks, Jonas. On the issue of the crisis subverting gender equity initiatives, yes, Gwamaka?
Okay.
Did you put your hand up?
Yeah, sorry to keep jumping in.
Right. I think that's fine, great.
I think COVID-19 has brought to focus quite a lot of these issues that, although have been part of the development discussion for a long time in Africa, have raised other areas, or at least kind of refocused other areas. Globally speaking, there's been a concern about domestic violence for both men and women, and how that's combated because of the lockdown procedures. But the second has been on access to things like mental health services, both in terms of what is available and the cultures around people accessing them. So, you know, typically, or at least the data is playing out that men do not access mental health services as much, and we've had a spate of suicides, a spike in domestic violence associated with particular forms of masculinity and definitions thereof. I don't think COVID will subvert initiatives. I think that can be built into any program without too much of a fuss or any additional resources. Maybe I say this as a self-defined feminist, but for me, you know, if the principle is equality, that's not really something that that costs. It's a behavioral shift, and that's not to take away from the technical work, but I don't see COVID as subverting that particular agenda. And given how gender roles are structured in a lot of Africa, going forward, any solution that is going to be proposed will inherently, whether by design or not, will impact on our current gender relations, and it's in our interest to really do this consciously to address them, to create a more balanced and equal society. So I don't think, personally, in the big picture, COVID-19 will subvert them.
Thanks, Gwamaka. Any other views on subversion of gender equity initiatives? Okay, I'm looking at time, and I'm going to take one more question. With the problems of corruption and differences between countries, populations, how accurate do you believe the infection numbers actually are, and what forms of regional cooperation is taking place to combat the virus and its implications on society, polities, and economies? Regional cooperation. Any views on what's currently taking place around regional cooperation? We know there've been initiatives on looking at economic integration Yes.
Okay. Oh, somebody else. Okay.
Boniface?
Yeah,
And
I
then,
just wanted to weigh in, I think, on the issue of the accuracy of the numbers. Obviously, this is an unfolding pandemic, and I think everyone is experiencing the same challenges in counting the numbers. Of course, we've been affected, I think, in some countries by the number of tests that are being done, but I don't think we should really look at the numbers as being exact, but they are just a reflection of the tests that have been done. I know that there have been attempts to either give them, they imply that the numbers are either exaggerated or are being underreported. I would think that if anything, we are more on the underreporting side rather than, I think, overreporting, largely because I think this is something that caught many countries by surprise, but we've also been improving, I think, over time, and I think over time one would have to say there. I think we are getting closer to the reality than we were maybe a few months back.
thanks, Dr. Dulani. Mcebisi Jonas, did you have your? I can't see you, so I can't.
Okay. Yes.
I think I heard your voice.
Yeah. No. I mean, in addition to what has just been said, I want to say a couple of things. The one is that it's very clear that I think regional cooperation and a kind of a continental action is going to be crucial, because in my view, I think we do need to promote multilateralism in responding to the pandemic. And part of it, I think, is understanding, and I tried to articulate this in some way, is that understanding that many countries can even not afford to actually come up with the packages that are required to deal with the pandemic, as it were. So it's a given that I think engagement with multilateral organizations is going to be probably a fundamental element of engaging in a new deal for Africa, in a new deal for the world, broadly speaking. And that's, I think, where our leaders should actually kind of galvanize their support towards. The second point I wanted to raise is that whether we kind of like it or not, good governance must also entail a more vigorous focus on reducing and confronting corruption in different countries. And I think the pandemic opens this up both for civil society and for governments to realize that credibility and integrity of the state is fundamentally important and has to be protected. And part of it is actually being able to raise some of the, because this is probably one of the few and rare moments in history where dependence on the state is so huge. And it's likely to be so for a couple of years. And for that to work effectively, the integrity of the state, its capacity, its cleanness and addressing of corruption, etc., becomes an important element of ensuring that the state is able to deal with what it's supposed to deal with. Thanks.
Thanks, Jonas. I'm going to wrap up the session, but first I would like to have each speaker to make a last comment if you want to. We've run out of time and we need to close the session. Thanks to the attendees for your comments. It's noted, and some of your questions. Unfortunately, we don't have the time, but we had mostly comments which were very positive and supportive of the current debate, and also made some important points which we will take into consideration. Last words from our speakers. Anyone can go.
let me go first, and again, to reiterate my thanks to you also, Shanil, for moderating. But I think to underscore the importance of leadership, not only I think in fighting this pandemic, but I think addressing a lot of the challenges that this continent really faces. So we should look at this as an opportunity for our leadership really to rise up to the occasion and to listen to multiple voices if we are to succeed in our fight against COVID-19. Thank you.
Thanks, Dr. Dulani, and thanks for joining us and contributing your insights and wisdom into this debate. Okay.
I cannot use the occasion just to thank you for inviting me. I think engaging with the panel such as this one, you learn a lot. But I think maybe one thing we should highlight is that we should continue with this engagement and strengthen active research on where the pandemic is going, but also strengthen dialogue, across different sectors of society, between experts and community leaders and activists, etc., to ensure that we drive an agenda that is based on proper scientific knowledge and basis, but at the same time ensure that we take on board some of the social and cultural dynamics in different communities and countries. Thanks.
Thanks, Mcebisi. I think that's a great suggestion to get in more voices and extend these dialogues, and we will definitely take that up in the post-Africa Day webinar series at UCT. And wish you well in all your initiatives and the African Marshall Plan. We have to find another name, obviously, not Marshall. Gwamaka, can we hear your voice from Paris? Any last comment?
For me, I think going forward, not just due to COVID, but especially as a result of experiencing, I think Africa really has an imperative to invest heavily on building the credibility of our public institutions and building in terms of their technical capacities and resources, but then also the trust between those, the public, and our governing individuals and structures. Where we've seen countries do well are where these are in place and functioning respectfully and relatively normally, whether this is Sweden, New Zealand, or elsewhere. So for me, I think if there's one lesson to go forward amongst the many public health related ones and economic ones, is that we really need to ensure that our institutions are both sound, are well resourced, and that we invest in building the trust that enables them to be effective without relying on a top-heavy, quite coercive style of implementation. So for me, it's really about trust and then about competence as well.
Thanks, Gwamaka. I think the building of capable institutions is something that there are many initiatives around, including the one from the Nelson Mandela School, and we will continue to support such initiatives. And we wish you well with the twins and enjoy raising them during COVID, which I suppose has its positive and its negatives. So we wish you well. Nomzamo?
Sure, Shanil. I think the one thing that is in my mind is about how we need to use this time to strengthen relationships. As Mcebisi was mentioning about how we need to strengthen the networks that we have. And I think in relation to civil society and the people more broadly, I think we need to rebuild the trust between the state and its citizens. And then we all need to act. I think this is a moment that needs all of us And I think we do need a bottom-up approach, and that will help us in seeing our circumstances improve post the crisis. Thank you.
Thanks, Nomzamo, and we are grateful that we have organizations like SERI and other NPOs that are putting out the voice of people and keeping government accountable. So we wish you well in all your endeavors to uphold democratic governance and uphold the constitution in South Africa. Then I would like to end by thanking all four of you, and also Ambassador Said Djinnit, who unfortunately couldn't join us, on behalf of UCT, the APRM and the Mandela School, for your valuable contributions to this debate and dialogue, which will be, as Jonas mentioned, something which will continue. And I would also like to thank my colleagues at UCT, DAD, CMD, and APRM, and my colleague Clever Chikwanda for making this event possible. And we wish you a very good day, and wish you well in all your initiatives to make Africa into the continent we will continue to be proud of. Thanks very much.
Thank you.